Hi, I'm Angie, your healthcare guide. Today we're tackling open enrollment, that time of year when you get to pick your health plan for the upcoming calendar year. I know choosing a plan can seem daunting, but don't worry. Whether you're employed or shopping on the marketplace, I'm going to help you pick a plan that fits your life, avoid sneaky pitfalls, and hopefully save you money. So let's dive in. Let's start with the basics. What is open enrollment? It's that window every year when you can sign up for or change your health insurance. If you get your coverage through work, it's usually in the fall for plans starting the following January 1st. If you're shopping on the marketplace, like healthcare.gov, it typically begins in November for coverage kicking in next year. Depending on what state you live in, though, it could begin earlier or a bit later than this. So be sure to check the healthcare.gov site or your state's marketplace site for more details. Miss this deadline and you're stuck with your plan or no plan, unless something big happens, like getting married or having a baby. So let's learn some basics and make sure you're covered. Choosing a plan is all about knowing what you're going to need for the upcoming year. Are you planning a surgery? Expecting a baby? Think about the types of things you are planning on having the upcoming year. Now, how much will it cost? Think about how much you can afford this upcoming year. Premiums are what you pay monthly. Think of this as your subscription fee. Also, as a refresher, deductibles are what you pay before insurance starts, helping with your medical bills. Copays are a flat fee per visit, and coinsurance is a percentage of the bill. You're going to want to pick a plan that balances these based on your needs. Don't grab the cheapest premium just because it's cheap. Low premiums can hide high deductibles or out-of-network gotchas. Remember, you want to choose a plan that is going to make the most sense for your upcoming year. Now let's talk briefly about some common plan types. I go over these in more depth in my plan types video, but for open enrollment, you'll want to know just a bit about what your options are. HMOs are going to be cheaper with lower premiums, but you'll need to stick to in-network providers and might need referrals to have your medical bills covered. PPOs, on the other hand, will let you go out of network, but you'll pay more monthly. And that high deductible health plan option with an HSA, that's a great option if you're healthy and want to save tax-free for medical costs. Now, if you're shopping for your own coverage, marketplace plans come in metal tiers: bronze, silver, gold, or platinum. Bronze typically has lower premiums, but higher costs when you use it. Platinum, the opposite. So how do you prepare to choose your plan? First, look back at the past year. How many visits and what types of visits did you have? Do you take any prescription medications? How many hospital stays did you have? Then think ahead. Do you have a surgery planned? Any new health concerns or diagnoses? Do you see any providers on a regular basis and need to account for these recurring visits? Maybe you're pregnant and planning on delivering after the new year. All of these things help to know when comparing plans. If you're employed, you'll typically compare these plans through a site provided to you by your employer prior to open enrollment. If you'll be using Marketplace to shop for a plan, healthcare.gov has tools to help. And don't just assume if you auto-renew for a plan you had last year that you're going to be fine. Plans can change year to year, and so do your needs. So make sure you check those plans out. Now, let's take a look at some real-life scenarios. First, Elise. Elise is planning to have knee surgery next year. She's looking at two plans through her employer. One with a $200 monthly premium, but a $2,000 deductible, and another with a $300 premium and a $500 deductible. Since Elisa's surgery could cost over $10,000, she picks the lower deductible plan to save big on out-of-pocket costs. On top of that, she also double checks that her surgeon is in network to avoid any surprises. Next, we have Maya. Maya is pregnant and due to deliver her baby next year. She's shopping for a plan on healthcare.gov and needs maternity coverage. She compares a silver plan with a $1,500 deductible and a gold plan with an $800 deductible. Maya ends up going with the gold plan for lower costs during labor and delivery and confirms her hospital and OBGYN are in network. And now, Liam. Liam sees a mental health provider weekly. He's looking at one plan with a $25 copay for mental health visits and the second plan with 20% coinsurance. Each session costs $160 before insurance. The first plan's copay means $100 a month for visits, while the second plan's coinsurance is a percentage of each visit, which could vary and add up quickly. Liam picks the first plan for predictable costs and double checks his mental health provider is in network. And there you have it. Open enrollment is your chance to choose a plan that fits for you for the upcoming year. Think about what you need, compare those plans, and don't wait till the last minute. On your healthcare guide, I'll keep breaking down topics like this. Things like how to navigate different health systems. If you like this video, please like, subscribe, and share. Thanks for watching, and I'll see you on the next one.